If you have diabetes, your feet might be at risk and you wouldn't even know about it. Just imagine a small blister not healing for weeks or months together, or worst case scenario, going into amputation. Shocking, right? In this video, we'll be talking about what is diabetic foot, what are the causes for it, how do you identify it, and how do you treat it, and what are the complications if you ignore it. Hi, I'm Dr. Meghla Bharat, General Surgeon, Zymus Hospital, Bangalore. How do you identify diabetic foot? Diabetic foot occurs due to reduced blood circulation in your lower limbs. Some of the common symptoms are numbness or tingling sensation in your lower limbs caused due to nerve damage, swelling, pain due to added infection, small cuts and wounds which takes weeks or months to heal, fungal infections, dryness and cracks, and foot deformities due to poor blood supply. For example, a 55-year-old male patient with uncontrolled diabetes steps on a small stone and doesn't feel it because of nerve damage. Days later, turns into an infectious wound causing gangrene and his toe had to be removed. The primary reason for diabetic foot is high uncontrolled blood sugar levels causing nerve damage in your legs. Poor blood circulation causes delayed wound healing. Wearing tight, uncomfortable shoes causes sores and blisters. Walking barefoot causes increased chances of injuries to the legs and infections from small injuries. Even a small cut can turn into a major infection. For example, a diabetic woman wears tight sandals, notices a blister from the shoe bite, but this blister can turn into a non-healing ulcer within weeks. There are multiple stages and severity in diabetic foot. These are stage 1, that is mild, where there is tingling sensation, numbness or pain over the foot. Stage 2 is moderate, including dry skin, small cracks and wounds which heals. Stage 3 is severe when these wounds become non-healing ulcers. Stage 4 is critical when these ulcers become gangrenous and requires amputation and surgery. For example, a 60-year-old diabetic comes to the hospital with a small non-healing ulcer in the foot. He is diagnosed with stage 3 diabetic foot ulcer and requires immediate debridement and hospital care. The various treatments for diabetic foot depends on the severity of the condition. Early stage symptoms can be treated with regular checkups, exercise, diet control, and proper medication. Regular foot care, keeping the foot moisturized and clean, and wearing proper footwear which is soft and comfortable and prevents the foot from having external injuries or pressure. For moderate diabetic foot with infection and wounds, proper wound care is required with regular dressing and debridement, antibiotics to treat the infection associated with the wound, special diabetic footwear for offloading of pressure from the affected areas. For severe cases with ulcers and deep wounds, we require debridement of the wound to clean the wound from slough and get healthy granulation tissue. We require regular dressings, hyperbaric oxygen therapy, and other surgical procedures such as debridement, fasciotomy to prevent the spread of the infection. For critical cases with gangrene, amputation is the last resort where the entire foot or the toe is removed to prevent the spread of infection. Why should you see a doctor? Well, seeing a doctor as soon as you notice any foot problem is crucial because a doctor can heal your small wounds before it turns into a non-healing ulcer, moderate your blood sugar levels, advise you the best diabetic footwear and foot care, and save your foot from amputation. What happens if you ignore your diabetic foot? Worst case scenario, you might end up with chronic leg pain and severe tissue damage, gangrene, non-healing ulcer, and worst come to worst, amputation of your limb. Diabetic foot problems are very serious and very, very common in India. It can be totally prevented by early management of the wound. If you or someone you know are diabetic, make sure you take proper care of the foot and check the foot regularly and wear proper foot care. If any blisters or small wounds, immediately come to the doctor and seek treatment. Your feet are precious. Take care of them.